All right. So some things that you are going to see are, regular GI disorders. So that would be things like GERD, peptic ulcer, and some other things. Um, Other things that can be affected by GI disorders are, let me just make this a little bit smaller so it's all on the screen. Okay, so some other things you might see if someone has a GI disorder is like a problem with absorption of B12, which we saw with the blood circulation. And a lot of times that's going to be caused by things like gastritis. Now, GERD, that's reflux, so that's like regurgitation or acid that's fluxing backward, and it's causing irritation. Ulcers, people can develop ulcers for a variety of reasons, but a lot of times it's stress related. And when it's not stress related, it's a lot of times medication related. So, like those aspirin, NSAIDs, alcohol, illicit drugs, and then irritable bowel syndrome, which for a lot of people this has to do with them in general. So like if their emotions are really high or they're nervous, this can affect their bowels, and you'll see different things happen with the bowels where they'll go back and forth between constipation and diarrhea. And then lactose intolerance usually has to do with you missing an enzyme that helps break down lactose in the body. Appendicitis, this main cause of appendicitis, and they always put this on the test question, either on the quiz or on the exam, is a fecal lith. And a fecal lith is a piece of hard poop, and it blocks those ducts and causes that appendicitis to occur. Hepatitis, okay, you have A, B, and C. How do I remember them? So I call it hepatitis ass because it's fecal oral. So for me, hepatitis A is hepatitis ass because it's transmitted fecal oral. They're all going to give you pretty much the same symptoms because they're all going to attack the liver and cause the liver to not work well, which is going to lead to jaundice, fatigue, and things like that. Okay. Hepatitis B, be in all your body fluids, everything wet except sweat. This is the hepatitis that you can get from somebody from their saliva. Like if you're drinking after them and they have an active infection. Okay. Typically, most hepatitis is transmitted through the blood, but you can get it, the B type, especially without the blood, and type A, you can get without touching blood because it's fecal oral. So if you change a poopy diaper and you don't wash your hands, or the other day I was watching 90 Day Fiance, and the girl had these like 3-inch nails, okay? And she took the finger and dipped it into Nutella. Now she sucked the Nutella off the finger, okay? I don't know where else that fingernail's been. And I guarantee you, when you go to the bathroom, when you're doing things that involve feces, you're not getting the inside of those fingernails clean unless you're scrubbing them with a scrub brush every single time for a certain amount of time. We know that's not happening. And then cirrhosis. So this is liver failure. This can occur for a couple of reasons. It could be alcohol related, but there are other things that cause cirrhosis. Pancreatitis. A lot of times we'll see pancreatitis. This is when you have inflammation of the pancreas. And the pancreas can also go into a mode where it starts to digest itself from the enzymes, and that can happen with pancreatitis. Pancreatitis will typically see that you could see that as a side effect of people that take like seizure medications like valproic acid, Depakote. That's a huge one. Another time when we'll see this is like when people drink a lot of alcohol, and they drink it over time, and then one day they just go out and drink the normal large amount of alcohol they've been drinking, but because of the damage that it's been given over time, they develop pancreatitis. And then gallstones, a lot of people will develop gallstones, and certain foods can contribute to the development of gallstones. But gallstones will develop, and that gallbladder itself, okay, will get um, necrotic and everything inside. And, the gallbladder is supposed to help you break down like that fat in your body and some of those lipids. So that's how it's going to affect you when you try to eat fried, greasy foods. It can make you sick. And then the gallstones, of course, as you're trying to pass them, could be very painful. Cholecystitis, this is inflammation of the gallbladder. Okay, and that was part of what I was just describing. This can be from gallstones backing up the ducts, and just from necrosis and things that are going on within that gallbladder itself. Short bowel syndrome, we call this dumping syndrome as well. These kids don't have a good setup in their intestines. So they're lacking some of the parts of the intestines and they're not able to absorb nutrients. So whenever they eat, it goes in, it goes right back out. So they're going to have malnutrition. A lot of times we can do like a transplant, put a new section of bowel of intestines in there for them. So add to that ileum area because the ileum, and you'll want to know this for the test, is where most of the absorption happens in that ileum. That's where the absorption happens. In the jejunum, that's where the pancreas sends enzymes to break down the fats and the lipids and things like that so that they can be absorbed in the ileus. Okay. And then so these kids are missing part of that ileum or the little finger-like projections that are in that ileum that help absorb the nutrients aren't working correctly or they don't have enough of them. So we'll try to fix that. But these kids will usually end up on TPN. This can also happen to people that have had gastric bypass and they'll end up with what we call dumping syndrome. One of the big issues with this is hypoglycemia because they don't maintain those nutrients. They don't hold on to them. They're not able to absorb the things that they need to maintain their blood sugar. And so, the nutrients go right out. And so they'll end up with bouts of hypoglycemia. That's one of the complications with the short bowel. Hernias, these are when you have a vessel that's weak and part of the vessel pouches out through the wall. And if you can see that little picture next to it, it's very small, but that's a pouching that's happening there. So sometimes this can happen because we have a weak area and we overwork that by lifting something or doing something to strain that area, and it causes that hernia to pop or develop. Of course, kidney failure, a number of things can contribute to that. High blood pressure, medications, really just doing a lot of things to your body that you shouldn't do to it, as far as drugs, drinking, uh, poor diet, but mostly that's going to be high blood pressure, diabetes, systemic lupus erythematous can affect all the organs. It puts those little deposits in there. Um, and then you can have an acute kidney injury. So this might happen because you were on a medication and maybe your kidney became toxic, or for some reason the kidneys weren't getting perfused for a short period of time. Maybe you had an MI or something like that. And then chronic kidney disease, that's what you're going to see in someone um, for long-term kidney. So this might be like your hypertension patient. This might be your diabetic patient, or someone that has like polycystic fibrosis of the kidneys. So that could happen. They grow like all these cysts on the kidneys. And then kidney stones. Okay, so kidney stones again, certain foods can cause those to develop in more people than others, and they can be difficult to pass. So usually we can strain the urine to see if someone has stones. We can give them something to try to break those stones down, and they're painful. So they can cause UTIs, they can cause hydronephrosis because they can back the urine up. So there's things that can cause damage as well with those kidney stones in the structure of the kidney itself. All right, so your GI system, those are the organs that you need in order to digest, absorb, and eliminate. So that's going to be the stomach, the intestines, the liver, the pancreas, and the gallbladder. Some of the symptoms that you're going to see are abdominal pain, bloating, diarrhea, constipation, nausea. Some people are going to have that acid reflux, like in GERD, ulcers. Again, even like, let's say you have a patient that has severe burns, that's going to put an incredible amount of stress on the body. If you have a chronic illness like diabetes or hypertension, that puts stress on the body. And that stress can lead to the development of these ulcers. If you're eating those Motrin or any sort of NSAID or aspirin, like it's candy, okay? You're not taking food with it, you're not following the precautionary measures, that can lead to development of these. And then you have irritable bowel syndrome, which is more about really, if you know people that have irritable bowel syndrome, that could be based a lot of times on anxiety, nervousness, and stuff like that. And it's considered a functional disorder. It can cause some abdominal pain, and some constipation and diarrhea back and forth, but you won't have any blood or anything like that. Inflammatory bowel disease, that would be like Crohn's and ulcerative colitis. Now, two big differences between those, okay? Crohn's is in the intestine, in the small intestine, and that is going to affect absorption. And ulcerative colitis is in the rectum or the anus area, and that is going to affect that area. That's where the ulcers are going to occur, but it does not affect absorption. And then your hepatitis, which I went over a little bit already. So we might have to do education with these patients. They may have to change their diet. Okay. They may need certain medications for a lifetime, and some of them may need surgical procedures. So let's go over some of the common GI disorders. So one is GERD. Okay. And again, this is where acid from the stomach backs up into the esophagus and it causes the person to have heartburn and discomfort. And I'm going to go over all this again when we do the lecture. But now I'm just trying to break it down to you in a simple manner so you can understand it. So when you hear it in the lecture, you'll be like, oh, yeah, okay, now I can start to make the connection. And you have to be able to do this. This is what critical thinking is. So, like, some of you are working on a care plan right now. And on that care plan, you may have been told, okay, you need more subjective or objective data because there's things in that client. Your client has a hip fracture. Okay. Why wouldn't you put in there that one leg is shorter than the other? That totally supports immobility because if my leg is shorter on one side than the other, I may have a hard time ambulating depending on why it's shorter. Another thing, why wouldn't you put in there about an abnormal x ray? And when you write vital signs, you don't just write the word vital signs. I need to know what those vital signs are because when I see those vital signs in the future, I need to compare them and analyze. So you're supposed to be putting that subjective and that objective in there to analyze. So when your client has a GI problem, what subjective and objective data do you have that supports the fact that you think they have celiac disease or you think they have an ulcer? You get that supporting data together, and now you can start to work on, okay, if they have, let's say, Crohn's disease, what are some of the issues they're going to have? You're going to have to work on them with diet because they're going to have a problem absorbing food. These clients will end up on TPN. So psychosocially, if I'm 19, 20 years old, I'm on TPN and I have Crohn's disease, how's that going to affect me? Physically, how is it going to affect me? And how's it going to affect my role in life as a person? So all those things are what you're addressing as the nurse. You're not addressing the fracture. You're not the doctor. You're not addressing the actual Crohn's disease. You're not the doctor. You're addressing the symptoms, the signs that the client is having, and you're trying to figure out how can I help them to decrease these symptoms. And pharmacy should be your last choice. Okay. How can I help them to decrease these symptoms so they can kind of function as normal as possible? All right, so we have peptic ulcer disease, and these are open sores that are going to be in the lining of the stomach. Okay. And, H. pylori infection. So they says often due to infection, that's going to be H. pylori most of the time. And prolonged use of the NSAIDs. Inflammatory bowel disease. This is where we have chronic inflammation, like in Crohn's and ulcerative colitis, and it actually damages part of that GI tract. And then celiac disease. This is a autoimmune reaction to gluten, and that gluten is going to damage the small intestines in that area where that lining is, that protective lining. And then you have hepatitis, which is inflammation in that liver. And this can be from a viral infection, from alcohol use, or from some sort of toxin that the person may have been exposed to. Any questions on any of that? Okay, so, symptoms that you're going to see, we went over these, but we'll go over them again. Abdominal pain, bloating and gas, diarrhea, constipation, nausea and vomiting, unintentional weight loss, and fatigue. So, that unintentional weight loss you're going to see in anybody that has an absorption issue. So, that's going to be like your short bowel syndrome, your Crohn's disease. Okay. And then sometimes you'll have weight gain with people that have things like a peptic ulcer. Anybody know why? Somebody might. Don't be scared to say it because other people might be thinking the same thing. So the reason why some of them have weight gain with the ulcer is sometimes when you eat food, it alleviates the symptoms of the ulcer. So, when they'll eat and then a couple of hours later they'll start to develop this pain, so they'll eat again trying to eliminate that pain. They'll also drink like exorbitant amounts of things like milk of magnesia, um, or Tums and things like that, trying to alleviate the symptoms. And that can put them in an alkalotic state because, they think it's over the counter, so it's safe. I can drink as much as I want. Alcohol's over the counter too, but can you drink as much as you want? Well, you could. It might not be a very pretty outcome for you. All right, so some tools that we will use to look at the GI tract are endoscopy and colonoscopy. So that endoscopy is going to look at the upper part of the tract, and that colonoscopy is going to look at the lower part of the tract. And for both of these, they usually put you under what we call conscious sedation. It's a light twilight sleep, and they'll give you a little bit of Versed and a Michael Jackson milkshake and do the test. Okay. And they can even take some biopsies when they're in there. Now, when they're doing the colonoscopy, if they see polyps in there, they're going to take some biopsies because polyps tend to cause a lot of problems. They can do the same thing with the endoscopy. They can go in and take a couple bites of the um, uh, tissue in there, okay, and do a biopsy of it. Some other things we might do are CAT scans or MRIs. And CAT scans and MRIs help us look at a structural problem. So if there's a problem with the way the organ or the area what we're looking at, we'll be able to see it on one of those tests. And then blood tests can tell us if there's some sort of bacteria or viral infection. It can tell us about inflammation. So what are those tests that we would do if we were looking for inflammation?
H. pylori.
Siri,
So H. pylori would tell us about the bacteria. What about for the inflammation?
Saturate.
C-reactive protein.
Right. C-reactive protein and RESR, our erythrocyte sedimentation rate. And then we can also look for imbalances in those enzymes, and we can check that blood for any sort of pathogens because sometimes people do pick up like bacteria or pathogens in the stool. We can check it for blood, and we can look at the digestive enzymes. And those digestive enzymes are mostly produced by the pancreas. So that will tell us a little bit about that pancreatic function. Now, for pancreatic cancer, a lot of people, I had two uncles that died from pancreatic cancer. So that's huge in my family. But my one uncle was fairly young when he got it. And his first sign was that he got a type 2 diabetes. His blood sugars started to go out of control. And then that happened in July. And in October, he was at a family barbecue and he was complaining of his stomach hurting. And there were some baked beans there. So people were kind of thinking, well, maybe it was the food. And then he ended up going to the doctor, and the doctor diagnosed him with constipation. And then they sent him to a specialist because it continued, and he was diagnosed with pancreatic cancer. And then that was November, okay? And he weighed 265 pounds in the beginning of October when I saw him. And if he weighed 90 pounds the day after Christmas, that probably was a lot. And he died that day. So that's a type of cancer that can take you out really quick. There is a type of pancreatic cancer that happens up in the neck or in the top of it, and they could do something on the people called a Whipple procedure. So if you have that type of pancreatic cancer, they could actually save you. Unfortunately, there are other types that happen. Some will happen in the ampulla of the pancreas, and some will happen down lower. And those types of pancreatic cancers usually have a poor prognosis. So, what are those main components of the GI system? So, we have the mouth and the esophagus, and digestion starts there with enzymes. So, you have like amylase in that saliva that's going to start to break things down. And then the food's going to move down through that esophagus and into the stomach. Stomach will break it down with acids and enzymes, and we'll talk a lot more about those details tomorrow, starting tomorrow. Okay, but that acid and those enzymes are going to break the food down. Small intestines, specifically the ileum, okay, is your primary site for nutrition absorption. And then the large intestine is mostly responsible for absorbing the water, forming the stool, and it holds beneficial bacteria there. And a lot of your vitamins are absorbed there. So a lot of vitamins, you're only going to absorb so much of them, and then they'll end up really in the toilet. And the remainder of it will end up at the sewage factory because your body's going to only absorb so much of it. Liver, gallbladder, and pancreas help produce bile and enzymes to help break down those foods for digestion. So a lot of times, when people have abdominal pain, it might be localized. So like for GERD, it might be in that upper esophageal area or right in that mid chest area. Okay, but if someone had irritable bowel disease, then that abdominal pain would be much lower. Irritable bowel syndrome can also lead to a lot of bloating and gas. Okay. And then you might have diarrhea and constipation, alternating symptoms with irritable bowel syndrome. With Crohn's, or celiacs, you'll see malabsorption issues and also with short bowel disease. Okay. So that's where that unintended weight loss comes in. So those three are malabsorption issues: celiacs, Crohn's, and short bowel disease. Okay. And then because they're not absorbing enough nutrients, it leads to fatigue. If they're not getting enough of proper vitamins and stuff like that, it can also lead to infection because it can cause them to be immunocompromised. It also can lead to things like anemia. Okay. If they have bleeding in the stool, they can lose blood. So that can lead to anemia as well. So, a lot of symptoms that these clients could have based on what their issue is. So some things that cause GI problems are infections. They could be viral, bacteria, or parasitic. Okay, parasitic is usually going to cause problems in that stool, like diarrhea or vomiting. Autoimmune factors, so irritable bowel disease and celiac disease. In these, the body can sometimes attack its own tissue. Lifestyle factors, so eating diets that are high in fat, low fiber intake, smoking, alcohol, even things like coffee because it's a vasoconstrictor and it stimulates certain activity in the stomach or the GI system. And then, of course, medications like NSAIDs. Antibiotics. How can antibiotics affect the GI tract?
It kills the good bacteria.
Yeah, so if we're constantly taking antibiotics, someone can develop something called C. diff, and that's really hard to get rid of. So usually, in order to get rid of C. diff, we have to give probiotics. Now, I'm a believer of Saccharomyces boulardii, which you guys might see now in a form called Florastor. And sometimes you can't get the insurance company to pay for that. You have to get it from places like vitamin stores because it's like a live bacteria. And you give them these pills every day. I guarantee it'll get rid of the C. diff. But a lot of doctors will first start them with vancomycin and flagyl. And, sometimes that works. But when people are immunocompromised and they get the C. diff, it can keep coming back. And of course, C. diff is a lot of times spread by healthcare workers or by older people. So like healthcare workers will go from room to room without changing their gloves sometimes or washing their hands. And then older people, when they go to the bathroom, a lot of times, especially older women, okay, because their nails grow long, people don't take care of their nails, all right? And then they can't see and feel when they're trying to go to the bathroom, when they're having a bowel movement. And when you watch older people wash their hands, how they do it, if they do it. Because a lot of them don't wash their hands if you don't say nothing to them, right? A lot of older people don't.
Yeah, they be so quick.
Yeah.
They
They
wash it
just,
so
and
quick. They just wet it and keep.
And no soap. They
yeah, no
just
soap, right? Just the
wet
water.
it. No soap.
Yep. They rub their hands together a couple times and they're gone. And really, when you see some of those old women in the long term care and you look up under their fingernails, they're pretty cruddy, right? And how do they eat? Some of them don't
With
use
their
their hands
hands.
because they have dementia. Some of them don't use a fork because they have dementia, right? And so when you have dementia, part of dementia is, remember from neuro, agnosia, right? Not remembering what certain things are. So instead of them picking up a fork and using it because they don't know what the fork is for, because it's easier for them to grasp the food and just put it in their mouth with their hands. So now that bacteria has a chance to transfer there. Okay. So these are things that you have to think about all the time. Also, when they go to the bathroom, they get up, they wash their hands, or they don't. And what are they touching now? Their walker, the door, the bed, food on the table, everything. And don't get me started on them in the kitchen, okay? Because your grandmom, your great grandmom, some of y'all, if your mom is older, okay, they don't throw anything away. They don't want to waste nothing. Oh, just cut the mold off and eat it. It's fine. So my mom came home, right? My mom was staying with me, and God bless her. She wants to cook. Okay. I don't really want her to cook because I just don't. A lot of that could go into a whole day sermon about why I don't want her to cook. But we went on a camping trip, and my camper, the refrigerator on it doesn't hold temperatures like in the house. So, we had a couple steaks left in there that we had cooked when we were camping, and we didn't eat them. So I was just going to give them to the dogs. And my wife brought a nice fresh roast home from Acme and she put it in the crock pot and she was letting it stew in there all day to get nice and tender for me. And of course, my mom thought she was helping, so she got the steaks that were like 4 days old out of the refrigerator and put them in the crock pot with the brand new roast. I was just too through. Um, that's a good way to get sick. And people don't realize, that the food and stuff that's out there now, there's something wrong with it, okay? When you can take a hamburger from McDonald's and lay it on the counter for 5 days and it still looks the same after 5 days, that should tell you something. All right. So things that we have to do is we need a diet that's rich in fiber. We got to stay away from processed foods. If you have celiacs, then you got to stay away from foods with gluten. So we use brow. That is our mnemonic. So we don't want them having brow is BROW. We don't want them having things like barley, rye, oats, or wheat. And then if they have GERD, we would want to stay away from foods that are acidic. And then hydration, okay, a lot of water. Water is good. Now, with your older population, that's a problem, okay? They don't like water. It's good for constipation, and if you try to give them water, they're going to be resistant to drinking it most of the time. Give them a shot, give them a old fashioned, they're fine. Okay. But for dinner, they like alcohol and dessert and Jeopardy. So, you got to try to encourage them. And there's some ways, you might be able to, put like drops in it to color it or drops in it to make it a little bit sweet. But the thing is getting that water in them. And then exercise. Okay. Exercise helps with the motility. All right. That gut has to be moving and it reduces stress. And again, stress can lead to what?
Ulcers.
Sir.
Ulcers. And if you have irritable bowel syndrome, it's going to affect that as well. And then probiotics, okay, like the Flora Store. Sometimes when your doctor, so another thing is when your doctor orders antibiotics, okay, you should insist that he orders a probiotic. Most of them do now, because of the antibiotic stewardship that's going on in at least in New Jersey. I would presume that it's going on in Pennsylvania as well. And how about you people that work in Delaware? Anybody on here that works in Delaware? How about Pennsylvania? Are they promoting this in Pennsylvania? Are you seeing this when your doctor's ordering the antibiotics that they're ordering the probiotics?
Yes.
Okay. So again, right here on the bottom, you see that stress and anxiety are going to affect that GI tract, that health. And it can exacerbate things like irritable bowel syndrome, GERD, dyspepsia. So now let's talk a little bit about GERD. Um, I'm not going to do that one up there because you don't need to know that. Okay, that's for kids. All right, so gastroesophageal reflux disease, that is GERD. And here, stomach acid is constantly flowing back into the esophagus. That reflux is irritating the lining of the esophagus and it can cause damage to it over time. So it's different from occasional heartburn. With GERD, like if I take the proton pump inhibitors, so if I don't take them every day, I'll feel that reflux there in my upper area of my GI tract. But you can sometimes just have heartburn. So, you're fine all the time, but maybe you eat a hot dog and that bothers you. or maybe you eat a spaghetti dinner and that bothers you. But with people that have GERD, it requires, constant management every day. So that sphincter should close there, okay? When that sphincter doesn't close, then it backflows into that esophagus. So usually they'll have a burning sensation in the chest after they eat or when they eat at night. It can be worse if they lie down. They may have regurgitation where they get a sour or a bitter taste in their mouth from the acid that's backing up there. They can have dysphagia or difficulty swallowing because that esophagus can become inflamed and narrow. They can have a chronic cough, especially at night, because the acid will sometimes irritate the throat or the airway. They can have laryngitis or be hoarse because of acid exposure to the larynx. Sometimes it can even lead to wheezing or difficult breathing if they have asthma. And it can make you feel nauseated or queasy, what we would call. So here's the cause, okay? These people have a weak lower esophageal sphincter, and that allows the acid to backflow or escape into the esophagus. They could develop a hiatal hernia. This is where part of the stomach pushes through the diaphragm into the chest, and that increases the risk for that GERD. They could have delayed gastric emptying, so the stomach takes too long to empty, and that increases the pressure and keeps that sphincter open, leading to the reflux. Or they could have increased intra-abdominal pressure because they're obese or because they're pregnant, and that's putting pressure on the stomach and pushing that acid back up towards the esophagus. So some things that can put the person at risk for this is obesity, because that can cause weakening of the lower esophageal sphincter from increased abdominal pressure. Eating foods that are high in fat, but other things that can trigger this are chocolate, caffeine, spicy foods, alcohol, smoking. Tobacco can weaken the lower esophageal sphincter and reduce the production of saliva, and that can neutralize sometimes the um, stomach acid. So when we don't have that saliva present, that can be an issue. Medications like antihistamines, calcium channel blockers, and antidepressants can cause the lower esophageal sphincter to relax and allow that backflow to occur. And then GERD is going to be more common in the older adult because of the weakening lower esophageal sphincter and other age related changes. Who else do you see really diagnosed with this are infants? All right. And a lot of times they're premature when they're having these kind of problems. So, because of that GERD, they can develop esophagitis, which would be inflammation of the esophagus, and that can cause painful swallowing and bleeding. It can cause narrowing of the esophagus because of scar tissue forming there. They can develop something called Barrett's esophagus, and this is where the cells in the lining of the esophagus change, and that would place them at risk for esophageal cancer. And again, respiratory issues like a chronic cough, asthma, or even pneumonia can come from aspirating that stomach acid into the lungs. If someone has dental erosion, the acid reflux, if the acid reflux is bad enough, it can cause dental erosion and erode the tooth enamel and lead to dental problems. All right, so we don't do treatments, guys, so you don't have to worry about that, okay? But you need to know what those risk factors are, and we'll talk about them more tomorrow as we're going through. All right, so the next one is peptic ulcer disease. And this is when you have ulcers, which are really open sores in the lining of that stomach. Okay, the upper part of the small intestines are going to have duodenal ulcers, and the lining of the stomach would have gastric ulcers. And they develop when there's an imbalance between the stomach acid production and that mucosa, which protects the GI tract. So when they take certain things, okay, or when they develop something like gastritis, it can damage that mucosa so that it's not working appropriately. Or if they have things like cystic fibrosis and stuff like that, it could block the ducts that are responsible for producing that mucosa or making that mucosa happen in the GI tract. All right, so gastric ulcers are going to be in the stomach lining, and they're associated with a higher risk of cancer. And duodenal ulcers are in the small intestines. And then you can also develop esophageal ulcers, which are in the esophagus, and they're usually from the GERD. Main causes of peptic ulcers are that Helicobacter pylori infection, and this is a bacterial infection. It's going to damage that protective mucus of the stomach, that coating of the stomach and the small intestines, and that allows the acid to get up in there and irritate it. NSAIDs, regular use of NSAIDs like ibuprofen and aspirin, which damage the stomach lining and increase the risk for those ulcers. Excessive stomach acid, conditions that cause increased acid production that can lead to ulcer formation. And then other things like smoking, which increases the acid production, alcohol, which can irritate and erode the mucus lining, and then stress that can exacerbate the symptoms and contribute to ulcer development. Any questions up to here? By the way, how was exam 2?
Wasn't bad.
Okay. So what
Do
kind of
you know how long it might take to be graded?
About to say, I'll let you know after I give my grade.
Yeah, the evening class didn't take it yet. They take it today. So tomorrow afternoon, we'll meet on the grades. I wouldn't expect to see him back before Monday. We might get lucky and get him on Friday. If I get him on Friday, I'll try to get him out to you guys, but I don't expect that will happen. It hasn't in the past. All right, so what kind of symptoms would we see with the peptic ulcer disease? Okay, so we're going to feel like a burning or a gnawing sensation in the stomach whenever it's empty. So this is why sometimes they'll eat or they'll take antacids. And usually they don't measure the antacids, right? You see them, they drink from the bottle. Bloating, they can feel like they're full or like they're swelling in the abdomen. And us ladies all know what that feels like. Nausea and vomiting. Sometimes they'll have blood. So if they vomit the blood and it's like a grainy coffee ground looking material, then that's usually an indication of some sort of GI bleed. Sometimes they can poop the blood. Okay. And there's different ways that they'll poop the blood. It can either be like in a black tarry stool. Okay. Or it can be bright red or frank blood. If it's dark or black, then that's considered upper GI. And if it's more of a bright red, then usually that's coming from the lower GI area. Loss of appetite, weight loss, and that can be from the nausea, the vomiting, the reduced appetite. And then if you look at the slide, it shows you some other things. So abdominal pain, hiccups, that burning, that black tarry stool, that abdominal pain, that loss of appetite, indigestion. That's when you're getting those little belches of that sour taste in your mouth, blood, vomiting, or coffee ground like material, and then either nausea or recurrent upset stomach. Again, you don't need to know the diagnostic stuff now, okay? One thing you just want to remember is that H. pylori, okay? They're testing for that because that's one of the main causes of the infection. All right, and then you could have gastric cancer. This can be from long-standing gastric ulcers. It's highly associated with those high pylori infections. And then sometimes we can have an obstruction, okay, where there's some sort of swelling or scarring that blocks the passage of food from either the stomach to the small intestine, or it could even block your ability to poop, right? So you could end up with like a small bowel or a large bowel obstruction. Okay, this is supposed to be gastritis, but whoever did this put the wrong slide in there. So let's see if I can pull gastritis. Well, we can use these ones. So nope, because this is all the wrong slide too. All right, so I'll pull something else up and talk to you about that. But gastritis is inflammation of the gastric mucosa, and that is the lining of the stomach. So it can be acute or chronic, and it comes from various things like infection, irritants, autoimmune conditions. Things that could cause this would be like uh, the bypass or the gastric surgeries. Um, Having gastritis over and over, um, alcohol absorption, sometimes, excessive coffee and smoking can irritate it. All right, so acute gastritis is going to be sudden inflammation due to irritants or infection. Chronic gastritis usually happens and lasts over a long period of time. And then you also have erosive gastritis, where the stomach lining's been eroded, and this is usually caused by some sort of introduction of NSAIDs, alcohol, or it could also be from stress. You can have non-erosive gastritis. Okay, this is the one that's mostly associated with the H. pylori infection. There's no erosion involved with this. And then again, common causes: H. pylori infection that damages the stomach lining, causes inflammation, prolonged use of NSAIDs that irritate the stomach lining, excessive drinking, physical or emotional stress, especially after surgery. Some autoimmune disorders, like atrophic gastritis, where the immune system attacks the stomach lining, bile or reflex that's backing up into the stomach from the small intestines, and then other viral or fungal infections. So they'll have a burning or a gnawing sensation in the stomach area. They might feel nauseous or vomiting, loss of appetite, bloating, indigestion, dark or black stools.